Chapter 62 Strokes. A stroke is the result of ischemia to a part of the brain or hemorrhage into the brain that results in death of brain cells, also known as a brain attack or a cerebrovascular accident. The cerebral arteries in the circle of Willis are shown here in figure 57-1 from the textbook. The top of the temporal lobe has been removed to show the course of the middle cerebral artery. Strokes are the fifth most common cause of death in the United States, and the leading cause of serious long-term disability. About 800,000 people have a stroke each year, with 15 to 30% resulting in permanent disability and a lifelong change for both the survivor and their family. Keep in mind that family and caregiver strain is going to be a very real consideration, as these patients will require a considerable amount of support. The risk for stroke doubles each decade after 55, and for gender, their strokes are unfortunately more common in men than females. Also, with ethnicity, there's a higher incidence and death rate in the African American community. Heredity and family history also play a major role. Our modifiable risk factors would include things like hypertension, heart disease, diabetes, high cholesterol, smoking, obesity, sleep apnea, metabolic syndromes, lack of physical exercise, poor diet, and drug and alcohol use. A transient ischemic attack. A history of TIA is associated with an increased risk for stroke. A transient episode of neurologic dysfunction can be caused by focal brain, spinal cord, or retinal ischemia, but without an acute infarction of the brain. When dealing with a TIA, the symptoms typically last less than an hour, and there is no way to predict the outcome. 1 out of 3 do not have another event, while another 1 in 3 have more TIAs. 1 in 3, unfortunately, further progress to a stroke. There are 2 different types of stroke, ischemic and hemorrhagic. An ischemic stroke is due to a thrombotic or embolic blockage, whereas a hemorrhagic stroke is an intercerebral or subarachnoid bleed. This is why it's so important that suspected stroke patients make it to the MRI as soon as possible, so that we can identify the cause. Is it a blockage or is it a bleed? With a blockage, we may be able to treat it with TPA or another clot-busting drug. Here in figure 57-2, we'd have the major types of stroke. On the left, we have a thrombotic stroke, where the process of clot formation results in a narrowing of the lumen, which blocks the passage of blood through the artery to the brain. Whereas in figure B in the middle, we have an embolic stroke. An embolus is a blood clot or other debris circulating in the blood. And what reaches an artery or one of the smaller blood vessels of the brain that's too narrow to pass through, it lodges there and blocks the flow. And finally, in C, we have a hemorrhagic stroke or a bleed. Here in figure 57-3 from the text, we have a hemorrhagic stroke. In this case, it is a massive hypertensive hemorrhage, rupturing into a lateral ventricle of the brain. In the case of an intracerebral hemorrhage, hypertension is the most common cause, with other causes including vascular malformation, coagulation disorders, anticoagulant drugs, trauma, brain tumors, or ruptured aneurysms. The extent of the symptoms varies and depends on the amount, location, and duration of the bleed. In the case of a subarachnoid hemorrhage, intracranial bleeding into the cerebrospinal fluid space between the arachnoid and the pia mater. It's often caused by a rupture of a cerebral aneurysm, trauma, or illicit drug use. In the case of a cerebral aneurysm, most are in the circle of Willis. The incidence increases with age and is unfortunately higher in women. It's also known as the silent killer, due to the loss of consciousness that may or may not occur. It has a high mortality rate, and survivors often suffer significant complications and deficits. The clinical manifestations are related to the location of the stroke, with the neural tissue destruction being the basis of the neurologic dysfunction. The effects of the body functions are related to the artery involved and the area of the brain it supplies. The time of the onset and symptoms and length of the period of ischemia is also extremely important. One key aspect to keep in mind is that a right-sided stroke affects the left side of the body, while a left-sided stroke affects the right side of the body. Aphasia occurs when stroke damages the dominant hemisphere of the brain as well as affects the language. In the case of receptive, this would mean a loss of comprehension, whereas expressive would mean a loss of the production of language. and global would be that total inability to communicate. Dysphagia refers to the impaired ability to communicate and is often used interchangeably with aphasia. In the case of non-fluent, this would mean minimal speech activity with slow speech, while a fluent patient would have speech that's present but has little meaningful communication. In the case of affect, patients who have had a stroke may have a hard time controlling their emotions. The emotional responses may be exaggerated or unpredictable, and magnified by depression, changes in body image, and loss of function. Keep in mind that both memory and judgment may be impaired because of a stroke. Although impairments can occur with strokes affecting either side of the brain, some deficits are related to the hemisphere in which the stroke occurred. The clinical manifestations of a stroke on the right side of the brain. These are more likely to cause problems in the spatial perceptual orientation. This would result in things like an incorrect perception of the self and their illness, as well as a unilateral neglect of the affected side. By this, you may see these patients only shave one side of their face, or may only brush their teeth on one side of their body. They may also have symptoms such as agnosia, which is an inability to recognize things, or apraxia, which is an inability to perform physical actions. In Figure 57-9 from the textbook, showing that spatial and perceptual deficits of the stroke, in this case, the patient is neglecting the entire left side of his meal because it is unseen and unacknowledged. Here we have a diagram of a brain stent used to treat the blockages in cerebral blood flow. In Figure A on the left, a balloon catheter is used to implant the stent into an artery of the brain, while in Figure B, the balloon catheter is moved to the blocked area of the artery and then inflated. The stent expands due to the inflation of the balloon. That balloon is then deflated and withdrawn, leaving the stent permanently in place, holding the artery open. The acronym FAST is often used to recognize the symptoms of an ischemic stroke. In this case, it would be symptoms resulting to the F for face, such as that facial droop you see, A meaning arms, such as an arm drift, S for speech, such as in the case of slurred speech, and the T meaning time to call 911. When caring for these patients, we want to establish a baseline neurologic assessment and monitor closely for signs of increasing neurologic deficits. Many patients worsen within the first 24 to 48 hours. An elevated BP is also common immediately after a stroke. It may be a protective response to help maintain that cerebral perfusion. TPA is that clot-busting drug we discussed earlier. It's given to reestablish blood flow through a blocked artery to prevent cell death. It's also why it's so important that we know the onset time of the stroke, as it must be started within 3 to 4.5 hours of the onset of clinical signs. Patients are carefully screened to ensure that it is a blockage clot and not a bleed. The surgical interventions used to treat a hemorrhagic stroke include evacuations of the hematomas, a resection or radiosurgery, as well as a clipping or coiling of the aneurysm. The procedure is chosen based on the site of the bleed. Here in Figure 57-6 from the textbook, we show what a clipping of that aneurysm looks like. In this case, we have a berry aneurysm where a metal clip is applied to block that off and help prevent further bleeding. A comprehensive neurologic examination is going to be critical, and this would include cranial nerve function, sensation, proprioception, cerebellar function, and deep tendon reflexes. Management of the respiratory system is going to be a top nursing priority. This would include things like risk for atelectasis, risk for airway obstruction, the fact that the patient may need endotracheal intubation and mechanical ventilation, and especially being on the lookout for aspiration pneumonia. After a stroke, the patient is at an increased risk for a venous thromboembolism, especially in the weak or paralyzed lower extremities. This is related to the immobility, loss of venous tone, and the decreased muscle pumping activity in the legs. The most effective prevention is keeping them moving. When dealing with the musculoskeletal system, the goal is to maintain optimal function. This is accomplished by preventing joint contractures as well as muscular atrophy. In the acute phase, range of motion exercises and positioning are extremely important. The paralyzed or weak side needs special attention when positioning as well. When dealing with skin breakdown, pressure relief by position changes, special mattresses, as well as wheelchair cushions should be another top priority. Remember to position the patient on the weak or paralyzed side for only 30 minutes. This would go in conjunction with good scan hygiene, emollients applied to the dry skin, and early mobility. In Figure 57-8 from the textbook, we have the assistive devices that post-stroke patients may use for eating. In Figure A, we have the rounded plate that helps keep food on the plate. The special grips and weighted handles are helpful with some people, and the cup shape allows drinking without having to tilt the head. In Figure B, knives with rounded blades are rocked back and forth to cut the food. The person does not need a fork in one hand and a knife in the other. In Figure C, plate guards help keep the food on the plate. And in Figure D, cups with special handles again promote independence. If muscles are still flaccid several weeks after a stroke, the prognosis for granting function is poor. The focus is on preventing additional loss. Most begin to show signs of spasticity with exaggerated reflexes soon after the stroke. And finally, I included a cartoon to end this one. It really illustrates a phenomenon called phantasmia, or olfactory hallucinations, in which a phantom or non-existent smell may be a symptom of a patient suffering a stroke. But anyway, that's all we got for this chapter. I'll see you in the next slides.